Continue to focus on the coronavirus pandemic here on Eyewitness News at 9. We're also focusing on your concerns and questions about the virus. Dr. David Schultz with Evansville Primary Care joins me again tonight to answer many of your questions. Dr. Schultz, thanks for being with us again tonight. Yesterday, during Governor Eric Holcomb's daily briefing, it was stated that the state has seen a decline in vaccines for children for things like whooping cough, measles, and others. One health official who spoke said there has been a drop-off of about 30 to 40%. Why do you think that is?
Well, right now, Brandon, with the COVID-19 pandemic, many people have rescheduled their normal appointments for their school physicals and so forth, where they normally would receive their vaccines. And even some of the infant vaccinations appointments have been rescheduled as well. And that's because they want to minimize exposure to those children. So we're recommending that children and also school-age kids who are due their vaccines, they should actually make their appointments and obtain those vaccines, because those are also very important diseases that can cause devastation without adequate immunization.
And speaking of children, there's been a lot of talk over the past few days about a mysterious illness in children in New York City. Some say it could be linked to the coronavirus, and at least 3 children have now died from it. What do we know about this illness, and does this change the thought that children really don't get sick from COVID-19?
Well, with regards to this mysterious illness in New York City, most researchers assert that this is probably some type of prodrome from the original coronavirus infection to begin with. And the reason for that is because they're finding that there are antibodies present in these children who have passed, and there are other children that have gotten ill who also are positive for the antibodies. Now, the question is it their immune system causing this to happen, or is it the actual viral infection itself? And most individuals believe it's a reaction in their immune system.
Now, if this illness is related to the coronavirus, why do you think we're just now seeing children die from that illness? Does this prove there's still a lot about the coronavirus that we just don't know about yet?
Well, most researchers are arguing this is proof that there's still uncertainty present with the coronavirus. And even most physicians, even Dr. Fauci, have indicated there's simply a lot about this we do not understand. And I would agree with that as well. And so what they're doing with these children and some of the other children who also are ill with this in New York City, they're researching their immune system right now to see if there's some error in their immune system, to see if there's an immunodeficiency of some sort, or just simply a different strain that may be attacking their immune system.
That's interesting. I want to ask you, there's a new report out that suggests that sunlight can kill the coronavirus. What are you hearing about that?
Well, there's a lot of truth to that. Even the World Health Organization early on they've commented that there is evidence that sunlight kills this infection. And most studies show that it's around 1.5 to 3.5 minutes of sunlight exposure directly will kill this RNA viral infection. Now, that said, most of these studies have been done indoors with controlled UV light. And that's different from the outdoors, where there are some days where it may be cloudy and other days where it may be sunny. And the other thing that's not been studied is how long will a mucus secretion or a droplet last on playground equipment directly exposed to sunlight. So they're researching that right now. But there's right now good evidence that the sunlight with UV light exposure will kill and eradicate this infection.
That is interesting. Well, the coronavirus, we know, attacks the lungs, and there have been some reports that people with the virus could have scar tissue build up in their lungs and that it could stay there even after they have recovered. Have you seen evidence of that?
We really have, Brandon. When we see the lungs of an individual affected with COVID-19, you see a lot of scarring that develops. And this is because COVID-19 causes adult respiratory distress syndrome, which causes a lot of inflammation. And when the inflammation begins to improve, it causes, for the patient at least, burning in the chest and lots of mucus secretions. But on the x-rays and the CT scans, it shows a white, hazy appearance, and that's the inflammation. And so what happens is, as the inflammation resolves and gets better, scar tissue develops in the lungs, and that provides a point where viral particles and also other infections can cause trouble and cause issues and so forth. It's only when the immune system is able to deliver enough blood with antibodies to attack these areas that one can really truly be eradicated from the virus.
All right, a lot of great insight again tonight. Dr. David Schultz with Evansville Primary Care, thanks for joining us again tonight.